ATTR-CM can be monitored over time several different ways. Number one, we assess and follow patients clinically, assessing their functional capacity, their ability to complete tasks, their quality of life. The presence or absence of hospitalizations can all be important from a clinical perspective. Furthermore, lab testing can be very helpful in terms of the follow-up for these patients. We check certain labs such as prealbumin, serum eGFR, serum troponin, and terminal proBNP, all in an effort to better understand the disease course and response to therapy for these patients with ATTR-CM. And finally, imaging may be a role as well. Advanced imaging with cardiac MRI can be of benefit when it comes to following these patients and assessing their response to drug treatment.
Indication and important safety information. Indication. Attruby, acoramidis, is indicated for the treatment of cardiomyopathy, of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults, to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions. Diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.